my name's Karen, and I've just completed a course for pain management, the input program at St Thomas's Hospital. Basically, I'm making this video because I think it's really important that people know about this program. It's a 4-week course. It's held at St Thomas's Hospital, and you can get referred by the NHS by your pain management specialist. The course itself for me was very important. I came to a point where you know, high medications, you probably all aware, you probably all take them, gabapentin, tramadol, and now I'm on ketamine, which doesn't get rid of the pain, but it certainly makes you feel more relaxed about the situation that you're in. And anybody knows that if you suffer with chronic pain, it can be very debilitating, and it affects all areas of your family life, your social life, work life. I couldn't believe it. It's just a short story. Basically had to have an operation on my back, had the operation. Within weeks I'd be back at work. I was absolutely devastated when, you know, 1 week turned into 2 weeks turned into a month, 2 months, and here I am nearly 4 years later, and with no cure. The actual healing process, you know, the operation they did, the healing process that took place, then, you know, some time down the line you get that diagnosis of, sorry, but there's nothing else that we can do for you. Which, when you hear that, well, I didn't actually hear it like that. I asked the pain specialist, look, you know, how long is this going to last for? And he said, how long is a piece of string? I came out of that office and I was completely broke down. I just went into some sort of funny depression thing. But the thing is that, you know, your whole world then just seems to just fall apart. Up until then, you have hope. The one thing that St Thomas's has taught me is that, okay, you have chronic pain and you can manage it. That's not the pain so much, although yes. However, because for so long you've been waiting for the diagnosis, or, you know, to be told, you know, there's nothing else that we can do, no other treatments are going to cure you or anything, then what happens is, because you haven't used your muscles, your ligaments, everything just tightens and tightens up. So St Thomas's, they do you know, a variety of things. They go through CBT, thoughts, feelings and behaviours, and how it all affects, intermingles, which I did know about because, you know, I've done a lot of hypnosis, so I do know about that CBT side of things. But I was still quite shocked of how, you know, doing the course, and, you know, the feeling I had was anger. But now I feel a lot calmer. I've gone through it, I've worked through it, feel very much more relaxed and more placid than I was before. They teach you stretches. Stretches, how important to try and get your body in some sort of, you know, back in condition. And, you know, at first there was, I think we were a group of 10 on the course, and, you know, they took us 1 hour to complete. By the end of the 4 weeks we actually managed to get down to half an hour. Now that is quite an achievement in itself, something that took a very long time. But the stretches themselves, they do work. I have to say that they do work. You know, you feel better, and, you know, the pain doesn't seem so intense in one area. It seems to be more spread out a little bit, evens itself out. You know, daily activities, they taught us how to pace, and this little machine is what they gave us, and it's a timer. Okay, as you can see on there, it's got 19 minutes. Well, they recommend 20 minutes, but I have 19. that is when, if you're sitting down, you must move position. You can move position forward, but you must twist or stand, or just change your position. Yeah. You know, and when you're doing pacing up activities, you start with a very, very low amount. I mean, I have a real problem from walking. My ability is very, very bad. But, you know, first of all, you might, you find your baseline. Then from that, then, 2-minute walk, and you just put 2 minutes on. When it bleeps, you stop and you have a rest. Okay? And you do it for a number of days. And then gradually, over a period of days, weeks, you increase it by seconds. Of course, then it turns into minutes. Very useful. I recommend. Then they taught us relaxation techniques. Now, relaxation techniques, I believe, are very, very important. You know, day-to-day life is so stressful, and chronic pain sufferers, we know stress increases pain. So we learn a variety of techniques to, you know, chill out. Take half an hour out of the day. I call this in my reset mode. I really enjoy relaxation. You know, some people really find it very difficult. You know, if you want to ask for any tips on relaxation, please feel free to contact me, and I'm quite happy to do that. So there we go. If you haven't had a referral from your pain specialist to St Thomas's, ask your pain specialist about the input program at St Thomas's. Now, you know, there's no cure, but it helps you to manage your life in a more positive way, and I hope this has been beneficial to you. Okay, any comments or anything, and you'd like to email me, ask for anything, feel free. Thanks.